This discussion is going to focus on, as your book classifies them, these social drugs. So we're going to have, again, a discussion of some of the more commonly used and abused social drugs, some legal, some illegal, and we're going to talk about some of the signs and symptoms of abuse of the drugs, why individuals choose to abuse and utilize social drugs in spite of known health risks. So as your textbook talks about, we're going to be kind of limited in our scope because obviously, there are textbooks devoted to just these types of drugs. So we're going to look at a select few and just kind of discuss some of the issues and problems surrounding them. So again, as I previously stated, we're going to be looking at a select few social drugs. Again, some of the more commonly used and abused. Again, some of these are legal classifications, some are illegal, some could be illegal based on age. So we're going to be looking at alcohol, tobacco, marijuana, cocaine, ecstasy, also known as methylene deoxymethamphetamine, and GHB, known as gamma hydroxybutyrate. I want you to note in your textbook on table 14.2 the classifications of commonly abused substances. Now, this part also gets into the street names. As you'll see, there are a lot of street names to these different drugs. I'm not concerned about you knowing every single street name for every single drug. What I do want you to be aware of, though, are the drugs and what classification they fall under. For instance, heroin, morphine, codeine, all are central nervous system depressants. Cocaine, amphetamine, methamphetamine, they would be considered central nervous system stimulants. The hallucinogens, marijuana, LSD, PCP, they're your hallucinogens, and then obviously anabolic steroids is their own classification. We will actually be doing a full discussion on anabolic steroids separately aside from the other social drugs. So just note those classifications, certainly look at the street names, but I'm obviously not going to make you memorize all of those. So in looking at kind of who uses drugs and some of the different characteristics of individuals who utilize drugs. I mean, drugs are utilized and abused by individuals of all ages. Obviously, in cases, there are certain instances where drug use may be more prevalent in a certain demographic and a certain personality type. When you look at the personality characteristics of an individual who will start to use and abuse illegal drugs, they're typically very rebellious, they're nonconformists, they are willing to be around other individuals who kind of display, deviant and inappropriate behaviors. They tend to be impulsive. So those are some of the characteristics. In your textbook in the chapter, note some of the others as well. To most of you listening to this, a lot of this should probably make sense just based off of what you've learned about illegal drug use in the past. Again, there's other things that you will commonly see just in family life, and again, these are some other things that your textbook talks about and is cited in research. So, for instance, in non-intact families where there may be one parent missing, there tends to be an increase in drug abuse. There tends to be an increase in drug abuse sometimes in people that have no religious affiliation. So again, those are things cited in research that tend to be, and they're also looked at in your textbook as potentially being issues. Certainly they don't stand alone by themselves. An interesting thing to note that after age 21, people usually don't experiment with drugs as often. So, that tends to be the age where there tends to, and that would make sense. It's actually at the point where if an individual's in college, for instance, if someone's going to experiment with a drug, they will usually do so early on in their college career versus later on when they're sort of getting closer to at least graduating from their initial 4 years of college. Some other issues with drug use, we commonly look at the long-term effects of drug abuse, which certainly there are a lot of issues associated with that. There's a lot of problems associated with acute drug use. For instance, acute alcohol intoxication. We know that there are a lot of bad long-term effects with chronic alcohol use and abuse, but obviously acute alcohol intoxication could cause a lot of problems. Again, one of the things cited with acute alcohol use and intoxication are the amount of head injuries associated with it. So a lot of those acute effects can cause issues as well. And then when you're looking at illegal drugs, since they're obviously not going to be regulated at all, you have to be concerned about the quality control. So, a lot of the times individuals selling street drugs will use fillers, and those fillers could be anything from basic toxins or even pesticides can be used as fillers. So and actually in a lot of instances those fillers that they use can actually contribute to a lot of the ill effects of the drugs as well. This chart on the screen kind of outlines the patterns of ergogenic drug use. So these would be drugs used specifically for the purposes of performance enhancement. And like I said, we're going to have a whole talk on nutritional supplements and also talk about anabolic steroids and things like human growth hormone in another discussion. But something to notice. So what do you notice about the types of drugs being used for ergogenic or performance enhancement purposes? The big spike you see is in ephedrine. So the stimulant type drugs are the things that people started to utilize much more after the early 90s. And you see, obviously ephedrine, has since been banned in over-the-counter supplements, but ephedrine was a very popular stimulant used, and we talked about stimulants previously, and part of this spike is likely attributed to the increase in diet pills and drugs touted as things utilized to decrease body fat. So that's likely where that big spike has come in. Interestingly enough, you see the decline in steroid use, and probably a lot of that, this is just my opinion, a lot of that has come in light of some of the potential health issues associated with the abuse of anabolic steroids. And here's a graph just kind of showing the patterns of social drug use. So we have the drugs, they're color-coded on the side there. You notice a slight decline in the use of alcohol on a regular basis, and this was done by the NCAA. Slight decrease in alcohol use. Marijuana has remained about at the same level. Smokeless tobacco has seen a minor decline in use. I mean, again, it sort of seems to defeat the purpose. It would defeat the purpose of any athlete to really abuse any of these drugs, but particularly a very common legal drug like tobacco. So there's been a slight decline, particularly in the smokeless tobacco. Interesting to note, there is still a small portion of student athletes who still abuse the psychedelics and also and also cocaine and crack. It still kind of remain level, albeit their use is very limited, which is probably due to the fact that, again, we're dealing with athletes here, so the hope would be that nobody would be using them, obviously, but they seem to be the least amount used in regards to the athletic population. So alcohol is a very commonly used drug. Obviously, over the age of 21, it is a legal drug, but it can be abused and have potential adverse health effects associated with it. An interesting thing to note that very low blood alcohol levels, there are actually some potential benefits. What they have found that with low blood alcohol levels, there's a decrease in hand tremors, There's an increase in throwing accuracy. So the question becomes, are there actually benefits to some individuals? And your book, uses the example of archery, for instance. So in other words, can somebody gain a benefit from it? The thing to note is that for the most part, your benefits of acute alcohol use on most athletes is not going to be beneficial. So what you're going to see is that, alcohol in the athlete system will definitely have negative effects, particularly in referencing motor skills. So in most sports, there's going to be impairment from alcohol. Again, with the exception of some very small group of athletes and extremely low blood alcohol levels, there's really there's no benefit in that regard. There are certain expectations. Your textbook talks about on page 195 the expectations. So a lot of times people will use certain drugs with a certain expectation of what they're going to experience from it. So I want you to note the 6 expectations of alcohol. So note that on that chart. And then here I obviously outline some of your adverse effects from alcohol use. Slurred speech, decreased coordination and reaction, deficits in coordination and reaction time, decreased visual acuity, dehydration, increase in acidic metabolites. So for instance, individuals, say, who have previously diagnosed health conditions, for instance, people with diabetes can really have a lot of issues, particularly with acute alcohol intoxication. So those are some things to keep in mind, and also to certainly educate individuals about in referencing alcohol use. In examining tobacco use, something to note is that there are more than 4,000 chemicals in tobacco, and a lot of these chemicals are things that individuals can actually produce a physical addiction to, as they're contained within the drug and the effects that they have on the body. So, for instance, one of the more, and this is the one talked about the most, is nicotine. So nicotine produces a similar reaction in the brain as acetylcholine. So that will lead to the continued cigarette smoking just based on the individual's pure enjoyment. Nicotine also reduces the amount of monoamine oxidase B activity, which is involved in dopamine breakdown, and that reduces motivating behavior in individuals who smoke. When we look at smokeless tobacco, people will a lot of times use smokeless tobacco because it's their perception that it's somehow safer. And while the mechanism of delivery is obviously different, it's not different from the standpoint in the fact that there are a lot of adverse health effects associated with the chemicals involved in the smokeless tobacco. So when we look at just the overall adverse effects of nicotine, the adverse effects of nicotine include irregular heart rate, blood flow irregularities, increased clotting mechanism, an increase in the circulating triglycerides, which can contribute to myocardial infarction. Some of the other things associated with just cigarette smoking obviously involve the lungs. And part of the mechanism there is the cilia, which helps to kind of move dirt and dust out of the respiratory tract, get overworked and damaged because of the cigarette smoke. So that will increase the tendency for the development of lung cancer. Cigarette smoke can also produce stimulatory effects. For instance, trembling, shaking, nausea, vomiting, depending upon the type of tobacco being utilized. So note the difference just between cigarette smoking and just the general effects of nicotine use. Obviously, with smoking cessation, it could produce a lot of beneficial effects, and there's a lot of different routes to help in stopping the use of tobacco. Some of those things are outlined in the text, everything from behavioral programs to patches can be utilized for that. The biggest hurdle that a lot of cigarette smokers or people that use tobacco face is the recidivism rate. Basically, there's a 90% recidivism rate after 1 year, meaning it's very difficult for people to stop using tobacco, particularly individuals who smoke. So more than 90% of people who quit smoking usually experience a relapse within 1 year of stopping. So it's very difficult. However, there's significant health benefits to an individual who stops smoking. So with marijuana use, again, you have to consider the other chemicals that an individual is going to take in when they use this drug. Again, there are more than 400 chemicals in marijuana. The active ingredient in marijuana is THC, or tetrahydrocannabinol. That's the active ingredient. Marijuana is considered a hallucinogen. So from the standpoint as far as where it would be classified, that's where that would be. Again, note, I talked about this in discussing some of these drugs previously. Look at the expectations that an individual has for using marijuana, or what they expect to get from the use. Again, one of the things that particularly as it relates to athletes, again, not so much even necessarily looking at it from an ergogenic standpoint, but they will utilize marijuana for just general relaxation purposes. So marijuana is classified as a hallucinogen, so a lot of your hallucinogens will have similar adverse effects. We have some of the adverse effects of marijuana listed here: anxiety and panic attacks, paranoia, increased mood alteration, increased heart rate, breaks with reality, memory, concentration, learning impairment, and decreased ambition and motivation are some of the things associated with marijuana use. Again, the active ingredient associated with it is the THC, so it's an important thing to note. And again, a big part of the reason why, individuals will use marijuana is just to help reduce their stress levels and allow them to relax. And sometimes individuals will use that as an excuse, particularly athletes, given the stress. If you're talking a college athlete trying to balance, athletics and academics, the issues associated with the stress with that. A lot of the long-term users of marijuana use can expect many of the same changes that cigarette smokers have. So a lot of the lung disorders just from inhaling the smoke can be associated with that as well. So definitely a chance of respiratory diseases, precancerous changes that can take place in the lungs with long-term marijuana use. Cocaine is another type of illegal drug that is classified here with the social drugs. Interestingly enough, there is a medicinal purpose for cocaine, and that is used as a local anesthetic, albeit physicians don't use cocaine for that purpose. But if you remember talking about local anesthetics in the previous chapter, they all end in the suffix -ine. So lidocaine, for instance, is a common anesthetic used. They're derived from cocaine. So there is a medicinal purpose for it. Obviously, the illegal abuse of cocaine, it is classified as a stimulant. It's derived from cocoa leaves. The abuse results in stimulation of your neurotransmitters in your central nervous system, and it will produce a stimulatory feeling, and it will produce a feeling of well-being. Note the expectations associated with cocaine use. The different methods associated with cocaine use, or the mechanisms by which people utilize it. Obviously, snorting it through the nose, where it could be absorbed in the blood vessels and passed to the central nervous system is one way. People will also smoke cocaine through a technique known as freebasing. Now, you can't your book discusses the process for this. It has to be basically, in order to freebase, an individual needs to process the cocaine to make it that it can be heated and smoked. And the last way in which cocaine can be utilized is when the form known as crack, where it's done, and that's the homemade version of freebasing that could be utilized as that as well. The fastest way people can get it into their system is through injection. That's the fastest way to get the drug to the brain. The slowest way to take it in is orally, through oral intake. The adverse effects of cocaine. So, there's local issues, particularly for those who snort the drug. So the snorting of cocaine particularly will result in a lot of nasal issues, so there can be potential damage to the actual structure of the nose and just some other chronic issues related to the nasal cavity. CNS overstimulation, so anything related to cardiac issues, and this could cause a lot of urgent cardiovascular. There's been many stories, particularly of even famous people overdosing on cocaine and having massive heart attacks, and death could occur from just a single use. Is something to note. So if an individual just overdoses one time and has a bad reaction, they can, death can occur from just a single use of cocaine. That takes us to looking at two drugs which are also called club drugs because of their popularity and where they're typically available in nightclubs. One of them, one of the more popular drugs in this classification is Ecstasy. The chemical name methylene dioxymethamphetamine. This chemical was discovered back in 1912, so that's actually been around for quite some time. It is amphetamine and mescaline based. Ecstasy itself will fall mostly under the CNS, the central nervous system stimulant-based drugs. Even though it does have hallucinogen properties, it is primarily because of the large stimulant properties associated with it. It'll be considered a stimulant drug. Various chemical variations of it has been produced, and recreationally it's been used starting in the 1960s. The main chemical reaction that occurs in the body is that there's a large amount of serotonin that gets released, and the feeling that it basically results in, here we kind of have it stated, it creates a love for everyone. But this class of drugs is basically a grouping of drugs that creates a lot of friendly feelings for other people. So again, that's why it tends to be very popular in as far as nightclubs are concerned. So now we have listed here the adverse effects of ecstasy: memory loss, nausea, vomiting, dehydration, fainting, clumsiness, uncoordinated movements, increased body temperature, which gets to be a concern because if the body temperature increases, it could cause other health problems and organ damage, and then liver damage and kidney failure from the processing of the drug. Gamma hydroxybutyrate, also known as GHB, is another drug that kind of grew in popularity for a while. It does create a sense of euphoria and a feeling very similar to alcohol intoxication. So if you think about the effects of alcohol intoxication, very similar effects here. One of the things it's been used for by individuals, it can help increase the REM sleep phase, or the rapid eye movement sleep phase. So it kind of helps people get into that deep sleep phase. So your book talks about how some bodybuilders would use it to help them get into that deep sleep cycle and remain there for longer periods of time, because it could help, the thought process there is it could help produce natural increases in human growth hormone, which would obviously then provide for greater recovery and growth potential. It can be bought at some natural food stores. It is, however, illegal in some states. So for instance, in Nevada it's illegal. There's a few other states that have also banned it. It does get rapidly absorbed in the mouth and pretty much begins to produce effects within an hour. You basically buy it in either tablet or powder form if it's going to be purchased. The adverse effects associated with GHB, the issue where a lot of the adverse effects, common to a lot of social drugs, GHB, when taken recreationally, a lot of times is combined with other drugs, particularly alcohol. This is, again, it's considered a club drug because of the prevalence used in nightclubs and bars, so it's obviously going to be consumed with alcohol. And that's where a lot of the adverse effects could come in. So nausea, vomiting, also could produce muscle weakness, extreme fatigue. It can promote depressive effects with the respiratory system, and could also cause coma. Something to note is that the therapeutic window is narrow. So what that basically means is the difference between a non-toxic and a toxic dose of GHB is very small. So even taking a little too much, it doesn't have to be a major overdose. Taking too much can actually produce these adverse reactions. And again, obviously, taking them with another drug, for instance alcohol, can produce those effects much faster as well. So what I'm going to list here are the discussion topics that are going to be due in the discussion post. So the first question is, why do some athletes use marijuana before competition when the central nervous system needs to be highly active? Another one will be, what are some techniques, both chemical and behavior, that people use for smoking cessation programs? And then 3 more questions that I'll have you kind of look at. They're listed here. I won't necessarily read them all off again. So make note of these questions as well. So all 5 of these class discussion questions I'll be looking for them in the answers in the discussion post for this chapter. And obviously, if there are any other questions, please feel free to contact me at any time.